Welcome. My name is Dr. Corinne Weaver, and I want to thank you first for choosing our office to become a patient here. And I know you probably have some questions right now, and that's why I'm here doing this video. Hopefully I can answer your questions on this video. These are the most frequently asked questions that we get on a constant basis. So I'm going to hit the highlights with you today. The first one is, what do we do? A lot of people come to the office and they don't even know what upper cervical is. Our whole foundation of our practice is based on the upper cervical principle of chiropractic. Cervical means neck, and we focus on the top two vertebrae in your neck. And I laugh about it, but my whole objective is to get your head on straight. I'm sure you've heard your parents say this, or maybe your mom, you need to get your head on straight. Because if the head is not properly aligned with the body, then we're going to have miscommunication between the brain and your body. And that's the most important step. So that's one of the things that I look at first. Then we do a lot of different testing and diagnostic testing. And the different diagnostic testing that we do in our office, it varies depending on what your need is and depending on what symptoms and signs that you're showing me in your exam and x-ray findings. We look at if you're having digestive problems. A lot of times I tell people that the brain and the gut communicate. So if we're having digestive problems, a lot of people have complained to the brain, like having brain fog or having forgetfulness or having headaches and migraines. So we're looking for triggers that's causing the main symptoms that you're coming in. So if you're having migraines, we're looking at, is it possibly a miscommunication between the brain and the body? Is it an upper cervical, what we call subluxation? Or is there certain food that's triggering it? There's so many patients that have food sensitivities that could be gluten, and when they eat gluten, it could cause a migraine or a headache. So we want to rule out these things specifically for your needs to figure out what's really triggering, what's causing your symptom. So we look at food allergies, we look at, like I said, stool, we're looking at bacteria, we're looking at how your brain is functioning. We actually do EEG in the office to look at different brain waves and see how you're functioning with your brain. There's so many kids today, and adults as well, that are suffering with ADHD and having not just ADHD, but having learning disabilities in school and behavioral issues where they can't focus, and so that makes them have more anger and temper issues at school. So we're looking at what's causing those issues. So, we may suggest getting, a stool test or a brain map, or we look at hormones as well. I'm really big about stress. People always ask me how I'm able to stay calm and stress. Well, not stress-free. We're all going to have stress, right? So, but we look at thyroid and we look at the adrenals, and all these things can contribute on how your body is functioning. So I don't want to rule anything out. I want to make sure that I have all the pieces to the puzzle so we can put a good game plan together to get you back well. Next question I always get is chiropractic. Can it hurt when I do the neck adjustment? A lot of people are scared about getting their neck adjustment. And you know what? I can understand. I had no idea what chiropractic was. And when I saw an upper cervical chiropractor, that changed my life forever. My story is I was 10 years old running my brand new pink bicycle, and I had a fall. And from that bike accident, I injured my head and neck. And from that day on, my body was not able to communicate. But after 10 years of suffering, of drugs and surgeries, and finding that there was no hope, chiropractic was the one that saved my life. I got that upper cervical chiropractic adjustment, and it did not hurt at all. In fact, when I got the adjustment, I was relieved. It was like so much pressure in the base of my head just gone. And I didn't even realize it was there. It was just built up with so much tension in my neck and shoulders. I got that adjustment. It was like, whew. And I was able to rest and just relax and breathe for the first time in 10 years since that bike accident. So we don't twist the neck when we're doing the adjustment. We're really precise. We actually do laser aligned x-rays that's really specific on how we do the alignment. And the reason why we do that is so that you can hold your adjustment longer. And that's the key. And that's what makes us different between upper cervical chiropractors to regular chiropractors. We actually use thermography. And thermography actually detects, it's a heat reading, but we're looking for certain patterns with that heat. And we want you to hold your alignment. And that's the big key. It's not continue to keep it getting adjusted. We want to do a few adjustments and get the body moving in the right position and innately allow your body to heal from within. So we have different devices to show if you're actually holding your adjustment. And that's, like I said, the key that we want to do. We want to allow your brain and body communicate without the need of continually getting adjusted 3 or 4 times a week. You know, a lot of people ask me, I'm scared to try chiropractic because I've heard once you start, you never stop. Like you can continue chiropractic forever. And you know how I answer that question, I've been in practice for 14 years and I continue to take care of my spine, and I don't force any patient to do anything, but when they see that they have felt better throughout their treatment plan, I always give them advice. You know, you could stop treatment or you could do what we call a preventative or wellness or maintenance plan, which is really just once or twice a month to come and get checked. And that doesn't mean that you're getting checked but it doesn't mean if you're getting adjusted every visit. We're at least checking to see how you're keeping your spinal alignment. In fact, just yesterday I saw a patient that he's been under wellness care for the last 6 years, and he only needed 2 adjustments last year. We did an updated on his films, and his spine has completely gone back to a normal position based on just 2 adjustments in a year. So it's just amazing with the power of the body when you deliver the right adjustment at the right time, how that body can really heal. And that's the exciting part, like I said, the healing means you're, you know, as you're holding, you're healing internally in your body. So another question that I tend to get a lot is, what do we do after we correct the spine? And like I said, we check on a regular basis. We use a thermography, and I'm using my hand like this. I know you guys can't see it, but we actually use a thermography device up into the neck, and it has color. It has different colors, like green's normal, yellow's mild, orange is moderate, and red is severe. And when we're looking at, and kids love to see the different colors, but like I said, I'm looking for a pattern. I'm looking for a really clear line, and there's different things that can affect that. Now, if you come to see me and you're taking, and this happens, you may be taking 10 to 12 to 15 different medications, right? And sometimes those medications are going to interfere with the scan. And so not that I want you to get off all the medications, but I want to get your body healthier so you're not depending on so many medications to cover up the Band-Aids. We're peeling off those layers so your body can hold and really heal from within. So if we're seeing that an issue is you're not holding your adjustment, or you know you're not doing as well as we thought care-wise, we're going to sit down with you and maybe come up with some recommendations. And a lot of it has to do with stress. You know, a lot of people ask me, what can I do to hold my adjustment? That's a big question. You know, really it depends on sleeping. I think sleeping is a big one. So laying down on your back, a lot of people complain, they say, I don't want to sleep on your back. But what I have found, if you can lay on your back with some pillows propped underneath your knees and a good, what we call cervical pillow for your neck, a good neck pillow to help with the curve in your neck, and you can stay there more relaxed. Now, a lot of people go to bed very tense and very tight. So just get into the routine of doing some deep breathing exercises to help relax your shoulders so you can get a better sleep. A lot of people, like I said, sleep on their side. Definitely don't sleep on your stomach. Please don't do that. But if you sleep on your side, all the time I have people have shoulder issues or numbness and tingling down their arm. They're kinking their neck. So if you can, really try to sleep on your back. That's probably the number one thing I would say that messes up your spine. Another thing is computer screens. We're always looking down. So you want to make sure that if you're at a computer screen and that's your job, is that you want to make sure that you're looking properly, you're keeping your shoulders relaxed, and you're not all tense leaning forward. So we encourage people to continue to lean back, and the reason why is we're taking that pressure off that base of the head. So when you bring your head back, your head's more aligned over your spine. There's not so much tension in your neck and shoulders. So that's something you can practice right now. Kind of go down here. All right, another question I get is how many visits do I need and how long is it going to take? What we have found, and it depends on your lifestyle. Typically, we see patients twice a week for a limited time, maybe between 4 to 8 weeks is average. And then after that, we see people hold their adjustments longer, go down to once a week for a couple months, and then they go to every other, and like I said, maintenance after that. So typically what we do is like a 4-month care plan, 4 months to 6 months, depending on how severe your case is. And most people, when they come in here, they know how severe their case is, or they've been having issues for so long, they know it's going to take longer. And I do encourage patients, it's not going to be just like that. As much as I would say I can adjust you and all your problems would go away overnight, I would be Jesus, right? I'm the miracle worker. I have seen patients respond that quickly with very severe, like Meniere's or migraine. Immediately they get that relief. But it doesn't automatically think the problem is fixed. It does take time for the ligaments and the muscles and everything like that to heal. So it does take, again, 3 to 4 to 6 months, depending how bad your spine. And if you've had some physical trauma like I did, it took me a year to recover after my bike accident when I was 10. And then at 21 is when I got under care. So it was 10, 11 years of not being treated properly. So it took me a year to fully recover and to feel comfortable about throwing away all my medication that I didn't need anymore, because I didn't need medication to breathe. I was actually breathing on my own. So it was breathing machines that I was living on. It was asthma and allergies. And so those things were able, didn't need those medications anymore over a course of a year. And I've not gone back. So, and that's just amazing to me that I hadn't had any medication since age 22. I'm not going to tell you my age. And lastly, the biggest question that I get is my insurance going to cover this? And goodness, I wish insurance would cover it. But unfortunately, insurance is sick care. And so they're not really health care. And so what we have found is that when insurance, if I was in network with insurance, they only allow so many visits to get you out of that Band-Aid stage. But what we're looking for is more long-term results. So you have to invest a little bit more into your health. But what you will find is when you invest in your health, just like buying some really nice shoes for if you were going to start running, instead of buying bad shoes, you buy the Brooks, right? You get the better shoes and you invest in those running shoes so you can run properly. And that's what we do here. We're going to give you the best quality care that we can and not be dictated by what your insurance company is going to cover. So when you come in for your visit, you will wait for a few minutes, a good 15 minutes. And the reason why we do that is so that your body temperature can be accommodated with the temperature that we have here. Because when we're doing the nerve scan, we want to make sure that we're getting an accurate reading. So you'll wait for a few minutes, be patient, and then we'll check your spine because we want to make sure that we're giving the right adjustment at the right time. After you receive your adjustment, we have patients rest. In fact, half of my office is designed for resting. And the reason why I did that is because when people take the time to really breathe and rest, they hold their adjustments longer. And that's what I want for you. So when you come and you get adjusted, expect that you're going to wait for about 15 and then you're going to rest for a good 15. So you're going to be here for a good 40, maybe 40 to 50 minutes while we're working on your spine for each visit. And that resting period is an important time for you to get your body back on track. So don't rush out of here and get adjusted and get back on 74. We want you to take the time to take the rest because we have found people hold their adjustments when they take that time to rest.